I would say, I mean, this is a very exciting new medication that is available, that hopefully will be available soon for patients with PSVT. PSVT affects close to around 2 million people in the United States. It leads to about 50,000 emergency room visits every year because patients have a sudden onset of a rapid heartbeat that causes some chest discomfort, some lightheadedness, causes them to really have discomfort and anxiety, and that leads them to the emergency room if they can't stop the episode on their own. As we often know that these rhythms can start and stop all of a sudden, and patients can sometimes do maneuvers to bear down to try to stop these PSVTs by themselves. But if it's not effective, then their only option is to call an ambulance to take them to the emergency room, or the EMS can give them an intravenous medication. This requires intravenous access and is inconvenient. So this new medication, etripamil, is formulated to be delivered as a nasal spray. So they can give themselves the drug, and within several minutes, they can abort their episode of PSVT and potentially avoid going to the emergency room. Yeah, I would say that that's right. Across the entire cohort, the median time to conversion, approximately 18 minutes, and to termination after administration of PSVT. This is the drug is absorbed intranasally, so it actually has peak plasma concentration within about 7 minutes or so. And so some patients respond much quicker than that. Compared to intravenous medications, which act much sooner, within a minute of an adenosine infusion, the PSVT can stop. However, adenosine is also associated with pauses or prolonged pauses in the heartbeat. Some people find this uncomfortable. They have this sort of sense of doom or shortness of breath. And it's unpleasant for them. But the etripamil drug, after it's given intranasally, leads to termination without these prolonged pauses of their PSVT. So some may find that more comfortable. However, it is formulated as an acidic solution. So some patients have had some complaints of nasal irritation or congestion, as shown in these trials that we've done. But when patients are weighing sort of the risks and benefits of having a PSVT that continues, that lands them in the emergency room, or having some nasal irritation, I think most of our patients chose the latter. Yeah, so as part of the etripamil trials, we wanted to prove the safety of this drug. So we took, I think it was close to 1,000 patients through multiple studies, wanted to evaluate whether they could have any adverse effects prior to first use. So we brought them in during sinus rhythm, during normal rhythm. We instruct them how to use the nasal spray. And then we observe them with heart rate monitoring and blood pressure monitoring for 30 to 45 minutes afterwards. So this test dose actually showed that the drug was quite safe. The failure rates were extremely low, maybe about 1.4% throughout all the multiple studies. And this led us to design the NODE 303 study, which is an open label study without a test dose prior to first use. And between the phase 2-3 studies with etripamil test dosing before use, and combined with the fact that there were no major adverse events even without test dose, we think that it's going to be safe to be used in an outpatient setting. I think patients do need to remember that they have to sit down when they use their drug to avoid any slight hypotension that could occur, or especially upon termination of the SVT. But the drug is quite safe, as shown through over thousands of patients in these trials. I think that if this drug is approved, it certainly is another tool to use for treatment and management of PSVT. Whenever I counsel patients about PSVT, I teach them how to do the Valsalva maneuvers to try to manage this conservatively, and we have ablation therapy on the other end. And then in between, there's this sort of middle ground of how do you manage them if they do not want an ablation. Can you give them medications safely? And in the guidelines, the most recent guidelines of PSVT management actually took out this approach for pill in the pocket therapy. So that's when patients have PSVT, can they give themselves a beta blocker or calcium channel blocker, some medication orally? That, of course, takes some time between when you swallow the pill and it's absorbed in the stomach, passes through the liver, and then acts on the heart. So there's a bit of a delay into that there to getting a therapeutic effect from the drug. This, in some small studies a couple decades ago, showed that there were some adverse effects of using that approach. Some patients actually having syncope and hurting themselves, passing out. And so this has been removed from the most recent PSVT guidelines. Imagine if this drug is approved by the FDA and PSVT guidelines are revisited, I think this would be factored into shared decision making, whether a patient wants to manage themselves with intermittent episodes of PSVT with this drug, etripamil, to be used on hand, or go straight to an ablation therapy, which we know is quite effective, but does have some small risks, procedural risks of complications, vascular injury, cardiac perforation, and then the most dreaded risk, which is pacemaker implantation, which occurs maybe about 1 in 200 patients, but is a known risk. So we always have to balance risk versus benefits when counseling patients.